few years ago, Dr. Esselstyn published a very important paper where he wanted to answer a few questions. He took 200 patients who recently were diagnosed with coronary disease. He put all of them through his educational program and then followed them for nearly 4 years, 3.8 years. We know from big cardiology trials that if patients came in today with heart disease, be it a heart attack or unstable angina, and are treated with the usual approaches, be they just medications or some are on meds and require stenting, some are on meds and may need bypass surgery, and then are sent home, but nutrition is not discussed with them, they generally have a recurrent heart attack rate of around 20 to 25% at 4 years. So that's what the baseline we're trying to beat is. With Esselstyn's group, his 200 patients were educated and again were checked on 4 years later to answer and ask a few questions. One is, how many people of the 200 are actually going to be compliant with a no added oil, whole food, plant-based diet? A lot of people predicted, oh, most people won't stick with that. With Esselstyn had more than 90% people compliant with the program at 3.8 years, which was amazing and showed that this is doable. Even more amazing was their recurrent event rate. So amongst the 91% of compliant patients, their chance of having another event at 3.8 years, instead of 25%, in Esselstyn's group it was 0.6%. So he basically nearly made them heart attack proof, or they nearly made themselves heart attack proof by following Esselstyn's advice, not only to be on the right meds after their cardiac diagnosis, but to focus on nutrition. So, like I've said before, if those patients had gone out after their heart attack, thrown all the meds in the toilet and said, what the heck with it, I'm not taking any medications, they likely all would have had an even higher event rate than 25%, maybe 30, 35%. So meds do play a role in reducing event rates, but nutrition takes you from 25% down to less than 1%, which is basically a 50-fold protection, which is a shame that more cardiac patients don't know about this information. Not to say that if we knew exactly what to do, we would do it all that way 100% of the time, but people have a right to know that nutrition is as important or more important than being on the right pharmaceuticals to treat their chronic disease and their life-threatening disease like coronary artery disease. And so like Esselstyn says, you know, this is an important bit of information. First is a person's right to know. And number two is it also takes patients from going around wondering, you know, with a 1 in 4 chance of having another heart attack at 4 years, that's psychologically pretty scary. Always wondering the next bit of heartburn or the next chest pain you have, is this the big one? Am I going to be done in? And that creates a lot of emotional turmoil and trauma in patients. All of a sudden now you can get them to say, you take the proper medications, but we're going to empower you now to take control of your lifestyle and focus on your food, and you can bring your risk from 25% down to less than 1%. It tremendously empowers a patient and gives them much more control, and they feel much better about themselves because they become aware that they have a much bigger role to play in their outcome than they ever thought possible.